Hello and welcome to our podcast today. We are joined today by Danielle Robinson, lead vaccination nurse for Northumbria Healthcare NHS Foundation Trust, who is here to talk about flu vaccinations. So we'll be talking about why we need them and why it is so important for frontline healthcare staff to be vaccinated against flu. So Danielle, welcome to our podcast today. Thank you for joining me. I wonder if we could start by talking a bit about you and your career journey. So could you walk us through, the steps that brought you to where you are here today in Northumbria?
So I have been a qualified nurse now for about 25 years. Originally, I've got a wide range of jobs within my past. I've started off in critical care. Wasn't for me, unfortunately. Good starting point, but wasn't for me. I then moved over to gynae in women's health. Loved that, but loved more sort of the health promotion aspect. I relocated up to Alston on top of the Pennines and started working in a community hospital. Very quickly identified that the young people up there didn't have anywhere to go about contraception advice or anything like that. So myself and the school nurse teamed up and put together that, and that was my sort of first insight into public health promotion. So spent about 7 years doing that and eventually moved back down to the northeast, where I carried on with public health work and worked in sexual health for 10 years. Following COVID, felt like I needed a bit of a change, so went to work for the school immunisation team. Loved that, but then COVID vaccines came out for children and I got asked to sort of oversee that within schools. I then got seconded into occupational health and wellbeing service to oversee staff vaccines. That was 2.5 years ago. Still there now, permanent, and I now oversee vaccines within Northumbria Trust. So staff vaccines, inpatients, maternal vaccines, support housebound care home. So it's never ending, but all very good.
Which brings us on nicely to vaccinations. So why are vaccines so important in today's society? And more so, why is it so important for frontline healthcare staff to get the flu vaccine?
Yeah, vaccines are really important. They stop us from getting poorly. They train our bodies to protect us against these viruses like flu. It's more so important with healthcare workers like our doctors and nurses. We are seeing patients that are either very old, very young, coming into hospital and they're already poorly. Getting the flu with a vulnerable patient, it can be detriment to their health. It can make them very, very poorly. So by frontline workers having their vaccines, we're protecting not only us but them and preventing the spread of flu.
Obviously, flu can spread very, very easily, very quickly. Presumably, it's no different in a healthcare setting as well?
No, so flu spreads from coughing and sneezing, door handles, bed rails, sort of thing. We work very closely together, colleagues, and with our patients within the hospital. So it's very easily spread.
As our only protection against flu, how does the flu vaccine stop the spread of flu?
So when someone gets their flu jab, their body learns to fight that and protect them against flu. It also prevents them from getting poorly, therefore less likely to sort of have the symptoms of flu, coughing and sneezing, and therefore prevent them from spreading it even further.
I guess a question many people might be thinking is, can healthcare workers spread the flu even if they feel fine?
Yes, so you can still have flu in your system, but you might not have any symptoms of it. So when we say symptoms, we're looking at your coughing and your sneezing. So it's important for healthcare workers to get the flu vaccine to prevent them from spreading it to those that are already unwell.
We hear about lots of vaccine hesitancy now in today's world, today's society. And there are some who believe that getting the flu vaccine will actually make you quite unwell, quite ill. Is there any truth to that?
So the flu vaccine isn't a live vaccine. It does not hold flu within the vaccine, so we are not giving you flu. What it can do is cause side effects. Side effects generally to people that are fit and well are mild, and they can last sort of 24 to 48 hours, and they could be sort of a little bit of a fever, coughing, sneezing, tiredness, sort of thing. But we do know that the majority of people, it doesn't last very long. But yeah, for all those concerned about it, it does not give you the flu. But I know some people feel with side effects that they can be quite poorly, but it does not last long.
So I guess then, what would you say to a colleague who thinks that they don't need to get the flu vaccine?
I would say think about who you are looking after. Think about those vulnerable patients, and not just those patients in the bed, the families coming in to visit those patients. So we're not just protecting ourselves by having the flu vaccine. We are protecting those patients. We are protecting our colleagues. We're protecting our loved ones at home. We're protecting Joe Bloggs in the street. We do need to try and reduce that risk from passing on to those that cannot have the vaccine due to medical reasons.
And presumably, if staff don't get the flu vaccine and then get sick, that will lead to pressures on within the system.
So during the winter, we face a lot of pressures, staff sickness. So by getting the flu vaccine, it will hopefully stop staff from becoming poorly. So you're not just protecting other people, you're also preventing yourself from becoming poorly over the winter and the winter pressures, supporting your colleagues and staying at work.
What advice would you give to a colleague who might be hesitant or worried about getting the flu vaccine?
It's safe, it's quick, it's painless, and we've got a duty of care, not for ourselves, but for everybody we look after. There's information out there, just to do your own research, ask about, and get the flu vaccine.
That's great. And why did you choose to get the flu vaccine yourself?
I have always had my flu vaccines. I haven't had flu myself, but I have looked after people who have had the flu, and it's not pleasant. Many people do feel like they've had flu when it could just be a very bad bout of cold. But seeing somebody that has had flu and looked after somebody that's had flu is quite scary. They are very, very poorly, and that's our young and fit people. So I've always had mine initially to protect myself, but now I do it to protect the wider team and the patients that we see.
And if you had one single line or message you could say to colleagues who might be hesitant about getting the flu vaccine, what would that be?
Be wise, immunise.